4.1 Autonomic Nervous System Introduction. Learning Objectives. Identify the classifications and actions of autonomic nervous system drugs. Give
examples of when, how, and to whom 4.1 Autonomic Nervous System Introduction. Learning Objectives. Identify the classifications and actions of autonomic nervous system drugs. Give examples of when, how, and to whom autonomic nervous system drugs may be administered. Identify the side effects and special considerations associated with autonomic nervous system drugs. Include considerations and implications of using autonomic nervous system drugs across the lifespan. Include evidence-based concepts when using the nursing process related to medications that affect the autonomic nervous system. Identify and interpret related laboratory tests. Identify nursing responsibilities associated with health teaching and health promotion. Have you ever wondered what causes your heart to beat or your lungs to breathe? These are examples of involuntary responses the brain controls without the need for conscious thought. The autonomic nervous system works using a balance of the sympathetic and parasympathetic nervous systems that regulate the body's involuntary functions, including heart rate, respiratory rate, digestion, and sweating. Many medications are used to control various cardiovascular, respiratory, gastrointestinal, and conditions by acting on ANS receptors. This chapter discusses the actions of ANS receptors and neurotransmitters and creates the knowledge base upon which the remainder of this book will build. Although the information in this chapter appears complex, it is a tool by which you will know the therapeutic effects and side effects of many classes of medications. By understanding the effects that occur when specific ANS receptors are stimulated or inhibited. For example, by knowing a specific medication is classified as a beta blocker, you will immediately know the actions of the drug are to slow the heart rate and lower the blood pressure. Additionally, if you know a medication is classified as an anticholinergic, you will immediately know the common side effects to monitor based on the mnemonic sludge. 4.2 Basic Concepts of the Autonomic Nervous System. This section will review key anatomy concepts in the autonomic nervous system related to the mechanism of action of medications. To review detailed information regarding the autonomic nervous system, see the related content below in OpenStax 1 Anatomy and Physiology. Review the basic structure and function of the nervous system. Review the anatomy of sensory perception. Review the anatomy of motor responses. Review the divisions of the autonomic nervous system. Review autonomic reflexes and homeostasis. Review information on a few drugs that affect the autonomic nervous system. Review of the anatomy and functions of the nervous system. The nervous system has two major components, the central nervous system and the peripheral nervous system. See Figure 4.1. The central nervous system is composed of the brain and the spinal cord. The peripheral nervous system includes nerves outside the brain and spinal cord and consists of sensory neurons and motor neurons. Sensory neurons sense the environment and conduct signals to the brain that become a conscious perception of that stimulus. This conscious perception may lead to a motor response that is conducted from the brain to the peripheral nervous system via motor neurons to cause a movement. Motor neurons consist of the somatic nervous system that stimulates voluntary movement of muscles and the autonomic nervous system that controls involuntary responses. This chapter will focus on the autonomic nervous system. Figure 4.1 Central and Peripheral Nervous System. The two divisions of the autonomic nervous system are the sympathetic nervous system and the parasympathetic nervous system. The SNS contains alpha and beta receptors, and the PNS contains nicotinic and muscarinic receptors. Each type of receptor has a specific action when stimulated. See Figure 4.2 for an image of the divisions of the nervous system and the receptors in the ANS. Figure 4.2 Components of the nervous system and ANS receptors. SNS and PNS functions and homeostasis. The sympathetic system is associated with the fight or flight response, and parasympathetic activity is often referred to as rest and digest. See Figure 5 to compare the effects on PNS and SNS stimulation on target organs. The 4.3 autonomic nervous system regulates many of the internal organs through a balance of these two divisions and is instrumental in homeostatic 6 mechanisms in the body. Figure 4.3 Effects of PNS and SNS stimulation on target organs. Stimulation of the SNS primarily produces increased heart rate, increased blood pressure via the constriction of blood vessels, and bronchial dilation. In comparison, stimulation of the PNS causes slowing of the heart, lowering of blood pressure due to vasodilation, bronchial constriction, and focuses on stimulating intestinal motility, salivation, and relaxation of the bladder. Homeostasis is the balance between the two systems. At each target organ, dual innervation determines activity. For example, the heart receives connections from both the sympathetic and parasympathetic divisions. SNS stimulation causes the heart rate to increase, whereas PNS stimulation causes the heart rate to decrease. To respond to a threat, to fight or flight, the sympathetic system stimulates many different target organs to achieve this purpose. For example, if a person sees a grizzly bear in the wilderness, the individual has the choice to stand and fight the bear or to run away. For either choice, several things must occur for additional oxygen and glucose to be delivered to skeletal muscle to fight or run. The respiratory, cardiovascular, and musculoskeletal systems are all activated to breathe rapidly, cause bronchodilation in the lungs to inhale more oxygen, stimulate the heart to pump more blood, and increase blood pressure to deliver it to the muscles. The liver creates more glucose for energy for the muscles to use. The pupils dilate to see the threat more clearly. Sweating prevents the body from overheating from excess muscle contraction. Because the digestive system is not needed during this time of threat, the body shunts oxygen-rich blood to the skeletal muscles. To coordinate all these targeted responses, catecholamines such as epinephrine and norepinephrine are released in the sympathetic system and disperse to the many neuroreceptors on the target 8 organs simultaneously. Chemical signaling in the autonomic nervous system. Neurons conduct impulses to the synapse of a target organ. The synapse is a connection between the neuron and its target cell. See figures 4.4 and 4.5 for images of synapse connections. 8. This work is a derivative of Anatomy and Physiology by OpenStax, licensed under CC by 4. Access for free at 9. Autonomic Nervous System by CNX. OpenStax is licensed under CC by 4. Figure 4.4. Autonomic system neurons conduct signals to target organs. Figure 4.5. Synapse is connection between neuron and target cell where neurotransmitters are released. Preganglionic neurons. The synapse is composed of a preganglionic neuron and a postganglionic neuron. Preganglionic neurons release acetylcholine onto nicotinic receptors on the postganglionic neuron. Nicotine found in tobacco products also binds to and activates nicotinic receptors, mimicking the effects of ACH. This is worth noting, because if medications were developed to impact the nicotinic receptors, then it would impact both the SNS and PNS systems at the preganglionic level. Instead, most medications target the postganglionic neurons because each type of postganglionic neuron has different neurotransmitters and different target receptors. Postganglionic neurons. There are different types of postganglionic neurons in the SNS and PNS branches of the autonomic nervous system. Postganglionic neurons of the PNS branch are classified as cholinergic, meaning that acetylcholine is released, whereas postganglionic neurons of the SNS are classified as adrenergic, meaning that norepinephrine is released. The terms cholinergic and adrenergic refer not only to the signal that is released, but also to the class of neuroreceptors that each binds. The cholinergic system of the PNS includes two classes of postganglionic neuroreceptors, the nicotinic receptor and the muscarinic receptor. Both receptor types bind to ACH and cause changes in the target cell. The situation is similar to locks and keys. Imagine two locks, one for a classroom and the other for an office, opened by two separate keys. The classroom key will not open the office door, and the office key will not open the classroom door. This is similar to the specificity of nicotine and muscarine for their receptors. However, a master key can open multiple locks, such as a master key for the biology department that opens both the classroom and the office doors. This is similar to ACH that binds to both types of receptors. The adrenergic system of the SNS has two major types of neuroreceptors, the alpha adrenergic receptor and beta adrenergic receptor. There are two types of alpha adrenergic receptors, termed alpha-1 and alpha-2, and there are two types of beta adrenergic receptors, termed beta-1 and beta-2. An additional aspect of the adrenergic system is that there is a second neurotransmitter in addition to norepinephrine. The second neurotransmitter is called epinephrine. The chemical difference between norepinephrine and epinephrine is the addition of a methyl group in epinephrine. The prefix "nor" actually refers to this chemical difference in which a methyl group is missing. The term adrenergic should remind you of the word adrenaline, which is associated with the fight or flight response described earlier. Adrenaline and epinephrine are two names for the same molecule. The adrenal gland secretes adrenaline. The ending -12 refers to the chemical being derived or extracted from the adrenal gland. Figure 4.6 Sympathetic and parasympathetic pre- and postganglionic fibers and neuroreceptors. ANS neuroreceptors and effects. The effects of stimulating each type of neuroreceptor are outlined in this section, and sample uses of medications are provided. Sympathetic nervous system. SNS receptors include alpha-1, alpha-2, beta-1, and beta-2 receptors. Epinephrine and norepinephrine stimulate these receptors, causing the overall fight-or-flight response in various target organs. Medications causing similar effects are called adrenergic agonists or sympathomimetics because they mimic the effects of the body's natural SNS stimulation. On the other hand, adrenergic antagonists block the effects of the SNS receptors. Dopamine also stimulates these receptors, but it is dosage-based. Dopamine causes vasodilation of arteries in the kidney, heart, and brain depending on the dosage. See Table 4. A for a summary of stimulation and inhibition of these SNS receptors. These effects will be covered in more detail in the remaining sections of this chapter. Table 4.2a, Comparison of medication effects of adrenergic receptor stimulation and inhibition. Interactive activity. An interactive H5P element has been excluded from this version of the text. You can view it online here. ANS Knowledge Check Basics by E. Christman for OpenRN is licensed under CC by 4. Adrenergic agonists. Adrenergic agonists stimulate alpha-1, alpha-2, beta-1, or beta-2 receptors. Stimulation of each type of receptor has different effects and further explained below. Alpha-1 receptor agonists. Stimulation of alpha-1 receptors causes vasoconstriction in the periphery, which increases blood pressure. Vasoconstriction also occurs in mucous membranes, which decreases swelling and secretions for clients experiencing upper respiratory infections. Examples of alpha-1 agonist medications are pseudoephedrine or phenylephrine and are used to treat nasal congestion. Alpha-2 receptor agonists. Stimulation of alpha-2 receptors reduces CNS stimulation and is primarily used as an antihypertensive or a sedative. An example of an alpha-2 agonist medication is clonidine, which is used to treat hypertension and also used to treat attention deficit hyperactivity disorder. Beta-1 receptor agonists. Stimulation of beta-1 receptors primarily affects the heart by increasing heart rate and contractility. It also causes the kidneys to release renin. Effects on the heart are described as having a positive chronotropic, positive inotropic, and positive dromotropic properties. Medications that stimulate beta-1 receptors are primarily used during cardiac arrest, acute heart failure, or shock. An example of a beta-1 receptor agonist medication is dobutamine, which is used to increase cardiac output in someone experiencing acute heart failure or shock. See Figure 4.7, illustrating dromotropic properties of stimulating beta-1 receptors. Figure 4.7 dromotropic properties affect the speed of conduction between SA and AV nodes. Beta-2 receptor agonists. Stimulation of beta-2 receptors causes relaxation in smooth muscle in the lungs, GI, uterus, and liver. Medications that stimulate beta-2 receptors are primarily used to promote bronchodilation, which opens the airway, and are often used to treat clients with asthma or chronic obstructive pulmonary disease. An example of a beta-2 receptor agonist medication used in asthma is albuterol. See Figure 4.8 for an illustration of the effects of stimulating beta-2 receptors in the lungs. Side effects of beta-2 receptor agonists are related to stimulation of beta-2 receptors in other locations in the body. For example, albuterol can cause tachycardia by stimulating beta-2 receptors in the heart. Stimulation of beta-2 receptors can also inadvertently cause hyperglycemia in clients with diabetes because of activation of beta-2 receptors in the liver, causing glycogenolysis. Figure 4.8 Effects of medications stimulating beta-2 receptors in the lungs. Adrenergic antagonists. Adrenergic antagonist medications inhibit the alpha-1, alpha-2, beta-1, and beta-2 receptors. The effects of inhibition of each receptor are explained further below. Alpha-1 antagonists. Alpha-1 antagonists are primarily used to relax smooth muscle in the bladder and cause vasodilation. Examples include the following. Tamsulosin is used to decrease resistance of an enlarged prostate gland and improve urine flow. Prazosin is used to cause vasodilation and decrease blood pressure in clients with hypertension. Alpha-2 antagonists. This classification is used in research but has limited clinical application. There are two types of beta antagonists: selective beta blockers, which inhibit beta-1 receptors and affect the heart only, and non-selective beta blockers, which block both beta-1 and beta-2 receptors, thus affecting both the heart and lungs. Beta blockers are also referred to as having negative chronotropic, negative inotropic, and negative dromotropic properties. It is also important for a nurse to remember that beta blockers can mask the usual hypoglycemic symptoms of tremor, tachycardia, and nervousness in clients with diabetes. Beta-1 antagonists. Beta-1 antagonists primarily block receptors in the heart, causing decreased heart rate and decreased blood pressure. An example is metoprolol, a selective beta blocker used to treat high blood pressure, chest pain due to poor blood flow to the heart, and several conditions involving an abnormally fast heart rate. Beta-2 antagonists. Non-selective beta blockers block beta-1 receptors and beta-2 receptors in the lungs. An example is propranolol, which is used to lower blood pressure by decreasing the heart rate and cardiac output. However, it can also cause bronchoconstriction by inadvertently blocking beta-2 receptors, so it must be used cautiously in clients with asthma or COPD. Interactive activity. An interactive H5P element has been excluded from this version of the text. You can view it online here. SNS receptor match by E. Cressman for OpenRN is licensed under CC by 4. Parasympathetic nervous system. Acetylcholine stimulates nicotinic and muscarinic receptors. Drugs that stimulate nicotinic and muscarinic receptors are called cholinergics. Medications are primarily designed to stimulate muscarinic receptors. Nicotine stimulates pre- and post-ganglionic nicotinic receptors, causing muscle relaxation and other CNS effects. An example of a medication designed to stimulate nicotinic receptors is the nicotine patch, which is used to assist with smoking cessation. Muscarinic agonists are also called parasympathomimetics and primarily cause smooth muscle contraction, resulting in decreased heart rate, bronchoconstriction, increased gastrointestinal, genitourinary tone, and pupillary constriction. There are two types of muscarinic agonists, direct-acting and indirect-acting. Direct-acting agonists bind to the muscarinic receptor. Indirect-acting muscarinic agonists work by preventing the breakdown of ACH, thus increasing the amount of acetylcholine available to bind receptors. Examples of direct-acting muscarinic agonist medications are as follows. Pilocarpine, used to treat glaucoma by causing the ciliary muscle to contract and allow for the drainage of aqueous humor. Bethanechol, used for urinary retention by stimulating the bladder to release urine. Examples of indirect-acting muscarinic agonist medications include the following. Pyridostigmine, used to reverse muscle weakness in clients with myasthenia gravis. Physostigmine, used to treat organophosphate insecticide poisoning. Donepezil, enhances memory in some clients with early Alzheimer's disease. Muscarinic antagonists are referred to as anticholinergics or parasympatholytics. Anticholinergics inhibit ACH and allow the SNS to dominate, creating similar effects as adrenergics. Their overall use is to relax smooth muscle. Sludge is a mnemonic commonly used to recall the effects of anticholinergics: salivation decreased, lacrimation decreased, urinary retention, drowsiness, dizziness, GI upset, eyes. Anticholinergics may also cause confusion and constipation and must be used cautiously in the elderly. See Figure 4.9 for an illustration of the sludge effects of anticholinergics. These are examples of anticholinergic medications. Atropine, specific anticholinergic responses are dose-related. Small doses of atropine inhibit salivary and bronchial secretions and sweating. Moderate doses dilate the pupil, inhibit accommodation, and increase the heart rate. Larger doses will decrease motility of the gastrointestinal and urinary tracts. Very large doses will inhibit gastric acid secretion. Oxybutynin relaxes overactive bladder. Benztropine reduces tremor and muscle rigidity in Parkinson's disease or in treatment of extrapyramidal reactions from antipsychotic medications. Scopolamine decreases GI motility and GI secretions, used for motion 17,1819 sickness and post-operative nausea and vomiting. Figure 4.9 Sludge effects of anticholinergics. Please review Table 4.2 billions for additional examples of anticholinergic medications. Table 4.2 billions Common anticholinergic medications. 4.3 Applying the nursing process to ANS medications. Assessment. Many classes of medications stimulate or inhibit specific ANS receptors to create desired effects. By understanding these common effects, it becomes easier for the nurse to recognize common side effects from a variety of medication classes resulting from the stimulation or inhibition of ANS neuroreceptors. Medications that stimulate ANS receptors often impact the heart, lungs, and blood vessels, so the nurse anticipates monitoring the client's blood pressure, heart rate, and lung sounds carefully for expected therapeutic effects and side effects. Medications classified as anticholinergics cause muscle relaxation, and the nurse anticipates monitoring for the side effects of urinary retention, constipation, dry mouth. Planning. Common goals related to administering medications that affect the ANS include the following. Client will adhere to the drug regimen. Client's vital signs will be within the desired range. Client will be able to verbalize the action of the medication as well as side effects to report to the healthcare provider. Implementation of interventions. A nurse should be aware of parameters to administer or withhold medications affecting the autonomic nervous system. If the order parameters are unclear, the nurse should withhold the medication following safe administration guidelines and notify the provider. For example, when no parameters are provided, blood pressure medications should not be administered if the client's apical heart rate is less than 60 beats per minute and/or the systolic blood pressure is less than 100% mmHg. Report any marked vital signs changes or suspected adverse effects. Implement full precautions when needed based on anticipated side effects of ANS medications. Evaluation. It is essential for nurses to know the reason why a medication is ordered for a specific client so evaluation of therapeutic effectiveness can be documented. For example, if the purpose of medication is to improve urine flow, then improvement should be seen and documented. Otherwise, the side effects may not warrant the use of the medication. 4.4 ANS medication classes. Classes of medication categorized according to neuroreceptor are further discussed in more detail in the following sections. Table 4.4 contrasts agonist and antagonist medications for each ANS neuroreceptor. Table 4.4 comparison of prototype medications that stimulate versus inhibit PNS and SNS receptors. See the supplementary YouTube videos in the boxes below related to sympathetic and parasympathetic nervous system medications. Sympathetic nervous system drugs. One or more interactive elements has been excluded from this version of the text. You can view them online here. 2. Forcia. B. Sympathetic nervous system drugs. YouTube. All rights reserved. Video used with permission. SJTPTM. 3. Forcia. B. Parasympathetic nervous system drugs. YouTube. All rights reserved. Video used with permission. One or more interactive elements has been excluded from this version of the text. You can view them online here. 4.5 Nicotine receptor agonists. A nicotine patch is a nicotine receptor agonist. Mechanism of action. Nicotine binds to and activates nicotinic acetylcholine receptors, mimicking the effect of acetylcholine at these receptors. Indications. Nicotine patches are used as an aid to smoking cessation and for the relief of nicotine withdrawal signs and symptoms as part of a comprehensive behavioral smoking cessation program. Nursing considerations. Nicotine is a hazardous drug. Use safe handling and disposal precautions. Apply one new patch every 24 hours on skin that is dry, clean, and hairless. Remove backing from patch and immediately press onto skin. Hold for 10 seconds. Wash hands after applying or removing the patch. Save pouch to use for patch disposal. Dispose of the used patches by folding sticky ends together and putting in pouch. The used patch should be removed and a new one applied to a different skin site at the same time each day. Do not wear more than one patch at a time. The patch may also cause vivid dreams or sleep disturbances. If these side effects occur, clients should be counseled to remove the patch at bedtime and apply a new one in the morning. Clients should also be counseled to not concurrently use other nicotine products due to potential toxicity. Side effects, adverse effects, discontinue use and call provider if an allergic reaction occurs, such as difficulty breathing or rash, or if symptoms of nicotine overdose occur, such as nausea, vomiting, dizziness, weakness, and rapid heartbeat. Individuals may also experience vivid dreams or sleep disturbances. Health teaching and health promotion emphasize that the client should stop smoking completely while on nicotine replacement therapy to avoid additive nicotine levels higher than smoking alone. Advise clients that participating in a comprehensive smoking cessation program improves success. If using a nicotine patch, clients should be aware that skin sensitivity at the site of patch placement typically resolves within 1 hour. Alert: advise the client to keep all nicotine products, including used patches, out of the reach of children and pets. Now let's take a closer look at the medication grid on nicotine patch in Table 4.5. Medication grids assist students to learn key points about each medication class. Basic information related to a common generic medication in this class is outlined, including administration considerations, therapeutic effects, and side effects, adverse effects. Prototype, generic medication listed in the medication grid, is also linked directly to a free resource from the U.S. National Library of Medicine called DailyMed. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Table 4.5 Nicotine Patch Medication Grid. 4.6 Muscarinic Receptor Agonists. Pilocarpine is a muscarinic receptor agonist. Mechanism of action: pilocarpine causes the ciliary muscle to contract, allowing for the drainage of aqueous humor from the anterior chamber of the eye, thus reducing intraocular pressure related to glaucoma. Indications: pilocarpine is used to treat glaucoma. Nursing considerations: apply light finger pressure on lacrimal sac for 2 minutes after instilling to minimize systemic absorption. Remove contact lens before administration. Side effects, adverse effects. Adverse effects of muscarinic agonists can be memorized using the mnemonic dumbbells reflecting diarrhea, urination, meiosis, bronchospasm, bradycardia, excitation of the skeletal muscle and CNS. Lacrimation, sweating, and salivation. Health teaching and health promotion. Advise the client to use caution with night driving. Additionally, use of this medication can cause hypertension. Now let's take a closer look at the medication grid on pilocarpine in Table 4.6. Table 4.6 Pilocarpine Medication Grid. 4.7 Muscarinic Antagonists. Atropine is a muscarinic antagonist. Mechanism of action: specific anticholinergic responses are dose-related. Small doses of atropine inhibit salivary and bronchial secretions and sweating. Moderate doses dilate the pupil, inhibit accommodation, and increase the heart rate. Large doses decrease motility of the gastrointestinal and urinary tracts, and very large doses will inhibit gastric acid secretion. Indications: varying dosages are used preoperatively to diminish secretions to stimulate the heart rate in conditions causing bradycardia, or to treat muscarinic symptoms of insecticide poisoning or mushroom poisoning. Nursing considerations, as with all anticholinergics, use with caution with the elderly because elderly clients may react with agitation or drowsiness. Heat stroke may occur in the presence of high temperatures. Immediately report symptoms of overdose, urine retention, abnormal heartbeat, dizziness, passing out, difficulty breathing, weakness or tremors. Physostigmine has been used to reverse anticholinergic effects. Side effects, adverse effects. Side effects include dry mouth, blurred vision, increased heart rate, flushed skin, agitation, urinary retention, constipation, and delirium. A mnemonic to remember the side effects includes red as a beet, dry as a bone, blind as a bat, and mad as a hatter. Health teaching and health promotion. Advise clients that use of these medications may cause dizziness and drowsiness. Additionally, use of medications may cause dry mouth, and frequent oral hygiene is encouraged. The use of atropine may cause urinary retention in males with benign 1 prostatic hypertrophy. Now let's take a closer look at the medication grid on atropine in Table 4.7. 4.8 alpha-1 agonists. Pseudoephedrine and phenylephrine are alpha-1 agonists. Mechanism of action. Alpha-1 agonists stimulate alpha receptors in the respiratory tract, causing constriction of blood vessels and shrinkage of swollen nasal mucous membranes, thus increasing airway patency and reducing nasal congestion. Indications. These drugs are commonly used for symptomatic relief in upper respiratory infections. Nursing considerations. Pseudoephedrine has had recent limitations placed on its use because it is a common ingredient in the illicit manufacturing of the drug methamphetamine. Pharmacies now require individuals to provide identification to purchase pseudoephedrine and must track the number of purchases. As a result, most over-the-counter decongestants now contain phenylephrine. Both should be used cautiously in clients with glaucoma, hypertension, or an enlarged prostate gland and are contraindicated in clients taking monoamine oxidase inhibitors, an older class of medication used to treat depression. Monitor for elevated blood pressure, urinary retention, nervousness, or difficulty sleeping. Do not administer within 2 hours of bedtime. Side effects, adverse effects. Alpha-1 agonists can cause headache, bradycardia, excitability, and restlessness. Rebound congestion may occur with nasal sprays. Health teaching and health promotion. Clients should be instructed to take medication as prescribed and be careful not to double doses. If they experience nervousness, breathing difficulties, or heart rate changes, they should notify their healthcare provider. Now let's take a closer look at the medication grid on phenylephrine and 2-pseudoephedrine in Table 4.8. 4.9 alpha-1 antagonists. Tamsulosin is an alpha-1 antagonist. Mechanism of action. Tamsulosin selectively blocks alpha receptors in the prostate, leading to the relaxation of smooth muscles in the bladder, neck, and prostate, thus improving urine flow and reducing symptoms of benign prostatic hypertrophy. Indications. Tamsulosin is used to treat BPH. Nursing considerations: avoid using with other alpha blockers. Tamsulosin is contraindicated with strong CYP3A4 inhibitors such as ketoconazole. Assess and monitor blood pressure, especially after first dose, because tamsulosin may cause orthostatic hypotension. Side effects: adverse effects. Alpha-1 antagonists may result in hypotension, weakness, and dizziness. Health teaching and health promotion advise clients to change positions slowly because the drug may cause orthostatic blood pressure changes. Additionally, the client should take the medication at the same time each day. The client should follow up with their healthcare provider to assess the effectiveness of the medication. Now let's take a closer look at the medication grid on tamsulosin in Table 2 4.9. Table 4.9, tamsulosin medication grid. 4.10 alpha-2 agonists. Clonidine is an alpha-2 agonist. Mechanism of action: clonidine reduces sympathetic outflow from the central nervous system and decreases peripheral resistance and renal vascular resistance. Indications: clonidine is used to treat hypertension and attention deficit hyperactivity disorder. Nursing considerations: monitor blood pressure and pulse rate. Can cause hypertension, bradycardia, and sedation. Rebound hypertension may occur if stopped abruptly. Side effects: adverse effects. Side effects of alpha-2 agonist medications may include hypertension, bradycardia, and rebound hypertension if the medication is stopped abruptly. The medication may also cause drowsiness. Health teaching and health promotion: clients should be taught the importance of adhering to the same dosing schedule each day and to not stop taking the medication abruptly or rebound hypertension may occur. Clients may experience orthostatic blood pressure changes and should be cautioned against the use of alcohol while taking this medication. Additionally, clients may experience increased susceptibility to blood pressure changes when exercising and exposed to hot environments. If the client experiences mental depression as a side effect of the medication, a different medication therapy may be needed. Now let's take a closer look at the medication grid on clonidine in Table 2 4.10. Table 4.10 clonidine medication grid. Alpha-2 antagonists. Alpha-2 antagonists are used in research with limited clinical application. 4.11 beta-1 agonists. Dobutamine is a beta-1 agonist. Mechanism of action: dobutamine stimulates beta-1 receptors to increase heart rate, force of contraction, and conduction velocity. Indications: dobutamine is used to treat cardiogenic shock and severe heart failure to increase contractility and cardiac output. Nursing considerations: in IV administration, dilute concentration before administering. Continuously monitor electrocardiogram, blood pressure, cardiac output, and urine output during therapy. Side effects: adverse effects. Adverse effects of beta-1 agonists include marked increase in heart rate and blood pressure. Individuals should promptly report difficulty breathing, angina, palpitations, or dizziness. Health teaching and health promotion: the client should be instructed to inform the nurse immediately if they notice chest pain, shortness of breath, or numbness or tingling in the extremities. 2. Now let's take a closer look at the dobutamine medication grid in Table 4.11. Table 4.11 Dobutamine medication grid. 4.12 Beta-1 antagonists. Metoprolol is a selective beta-1 antagonist. Mechanism of action: metoprolol primarily blocks beta-1 receptors in the heart, causing decreased heart rate and decreased blood pressure. However, higher doses can also block beta-2 receptors in the lungs, causing bronchoconstriction. Indications: metoprolol is commonly used to treat high blood pressure, chest pain due to poor blood flow to the heart, as an early intervention during a myocardial infarction, and in several heart conditions involving an abnormally fast heart rate. Nursing considerations: don't crush extended-release formulations. Assess the client's apical pulse rate and blood pressure before administering the drug. Withhold the drug and call the provider immediately if the heart rate is slower than 60 beats minute, unless other parameters are provided. In diabetic clients, monitor glucose level closely because the drug masks common signs and symptoms of hypoglycemia. Side effects: adverse effects. Beta-1 antagonists may result in decreased blood pressure or heart rate. Significant adverse effects include hypotension, bradycardia, and worsening heart failure. Other potential side effects include fatigue, dizziness, depression, insomnia, nightmares, GI upset, erectile dysfunction, dyspnea, and wheezing. Boxed warning: when stopping therapy, the dosage should be tapered over 1 to 2 weeks because abrupt discontinuation may cause chest pain or myocardial infarction. Health teaching and health promotion: clients should be instructed to take the medication as prescribed. They should be advised that abrupt cessation of medication therapy may result in life-threatening cardiac arrhythmias. Clients should also be taught how to self-check pulse and blood pressure to assess the effectiveness of medication therapy. Additionally, they should be cautioned against sudden changes in position due to orthostatic blood pressure changes. Clients may experience increased sensitivity to cold and should be cautioned to avoid caffeinated substances. Now let's take a closer look at the medication grid on metoprolol in Table 2 4.12. Table 4.12 Metoprolol medication grid. 4.13 Beta-2 agonists. Albuterol is a beta-2 agonist. Mechanism of action: albuterol is a selective beta-2 agonist primarily used to cause bronchodilation in the lungs. However, beta-2 receptors in the heart can also be stimulated, causing cardiovascular side effects. Indications: albuterol is commonly used to treat asthma and chronic obstructive pulmonary disease. Nursing considerations: monitor respiratory rate, oxygen saturation, and lung sounds before and after administration. If more than one inhalation is ordered, wait at least 2 minutes between inhalations. Use a spacer device to improve drug delivery if appropriate. Side effects: adverse effects. Albuterol can cause hypersensitivity or paradoxical bronchospasm. It can also produce a clinically significant cardiovascular effect in some clients by causing increased heart rate and blood pressure, which may require the drug to be discontinued. Health teaching and health promotion: clients should remain compliant with the medication dosing regimen. Individuals should contact their healthcare provider if they experience ongoing shortness of breath unrelieved with medication therapy. If using an inhaler, the client should be sure to prime the inhaler prior to administering the first dose of medication. The medication can cause an unusual taste in the mouth. so clients should rinse their mouth with water after each use. Table 4.1 3-albuterol medication grid. 4.1 4 beta-2 antagonists. Propranolol is a non-selective beta-2 antagonist. Mechanism of action: propranolol is a non-selective beta blocker because of its inhibition of both beta-1 and beta-2 receptors. Indications: propranolol is used to treat high blood pressure, angina, various heart dysrhythmias, essential tremors, and in migraine prevention. It is prescribed after a client experiences a myocardial infarction to reduce mortality by decreasing heart workload. It is also used for the management of panic associated with panic disorder and post-traumatic stress disorder. Nursing considerations: non-selective beta blockers must be used cautiously with clients who have coexisting asthma or chronic obstructive pulmonary disease because of the effects on beta-2 receptors that could potentially cause bronchoconstriction. It can also mask symptoms of hyperglycemia in diabetics. Use with caution in clients with impaired hepatic or renal function. Give immediate release formulations on an empty stomach. Do not crush extended release formulations. Propranolol ER is not considered a simple milligram for milligram substitute for conventional propranolol. Check blood pressure and apical pulse before giving drug. Withhold and notify provider if apical pulse is less than 60 beats per minute or systolic blood pressure is less than 100 mmHg, unless other parameters are provided. During IV administration, monitor blood pressure, ECG, and heart rate according to agency policy. Side effects, adverse effects. The most serious adverse effects include bronchoconstriction, hypotension, bradycardia, and signs of worsening heart failure. Other adverse effects are similar to selective beta blockers like metoprolol. Boxed warning: abrupt withdrawal of this drug may cause exacerbation of angina or a myocardial infarction. To discontinue this drug, gradually reduce dosage over 1 to 2 weeks. Health teaching and health promotion clients should be instructed to follow. The medication dosing regimen. Stopping medication therapy abruptly may cause life-threatening arrhythmias. Clients should be instructed on how to self-assess pulse and blood pressure to evaluate medication effectiveness. The medication may cause increased susceptibility to orthostatic blood pressure changes and increased sensitivity to cold. Now, let's take a closer look at the medication grid on propranolol in Table 2 4.14. Table 4.14 Propranolol medication grid. 4.15 Alpha and beta receptor agonists. Epinephrine and norepinephrine. Epinephrine and norepinephrine are adrenergics that stimulate the beta and alpha receptors on the target cell. Mechanism of action: epinephrine acts on both alpha and beta adrenergic receptors and is used in several routes, including intravenously, subcutaneously, intramuscularly, and inhalation. Epinephrine decreases vasodilation and increases vascular permeability through its alpha adrenergic receptor action, which can lead to loss of intravascular fluid volume and hypotension. Through its action on beta adrenergic receptors, epinephrine causes bronchial smooth muscle relaxation and helps alleviate bronchospasm, wheezing, and dyspnea that may occur during anaphylaxis. Indications: epinephrine is used for severe allergic reactions acute bronchospasm during asthma attacks, cardiac resuscitation, hypotension in severe shock, or for local injection to control superficial bleeding. Norepinephrine is used as a peripheral vasoconstrictor and as an inotropic stimulator of the heart and dilator of coronary arteries in clients with critically low blood pressure. Nursing considerations. Epinephrine is contraindicated for use in fingers, toes, ears, nose, or genitalia when used with local anesthetic due to the vasoconstrictive action. It is also contraindicated in clients with narrow-angle glaucoma. Administer with caution to the elderly and those with pre-existing cardiovascular disease. Discard IV solution if discolored. When administering monitor vitals and cardiovascular and respiratory systems closely. If blood pressure increases sharply, give rapid-acting vasodilators. Monitor IV site for extravasation. If extravasation occurs, immediately stop IV administration and follow agency policy. Phentylamine, an alpha-adrenergic antagonist, is the reversal agent used to reverse local vasoconstrictive effects if digital ischemia occurs. Side effects. Adverse effects. Common side effects include hypertension and tachycardia. Health teaching and health promotion. Epinephrine formulated in a pen for injection is known as an EpiPen. An EpiPen is used for severe allergic reactions after exposure to an allergen such as a bee sting. Check expiration date, store at room temperature, and protect from light. Effects fade after 15 to 20 minutes, so seek medical care immediately. Now let's take a closer look at the medication grid on epinephrine and 2-norepinephrine in Table 4:15a. Table 4.1 5a epinephrine and norepinephrine medication grid. Dopamine. Dopamine is another type of catecholamine specifically used to improve perfusion of organs, improve cardiac output, and increase blood pressure. Dopamine has dose-dependent effects on targeted arteries in the kidneys, heart, and brain. Mechanism of action. In low doses, dopamine mainly stimulates dopamine receptors and dilates the renal vasculature. Moderate doses of dopamine stimulate beta receptors for a positive inotropic effect. Higher doses also stimulate alpha receptors, constricting blood vessels and increasing blood pressure. Indications. Dopamine is used to treat shock, improve perfusion to vital organs, increase cardiac output, and correct hypertension. Nursing considerations. During infusion, frequently monitor blood pressure, cardiac output, urine output, and color and temperature of limbs. Dopamine can worsen cardiac ischemia and worsen chest pain for clients experiencing unstable angina or a myocardial infarction due to increased cardiac demand for oxygen. If urine flow decreases without hypotension, notify provider because dosage may need to be reduced. High doses of dopamine cause vasoconstriction and can cause adverse effects if extravasation occurs. Concurrent alpha or beta blockers can antagonize dopamine. Side effects. Adverse effects. Common side effects include hypotension with low doses and hypertension in higher doses. Other side effects include tachycardia, palpitations, and dyspnea. Adverse effects include decreased blood flow to the extremities and decreased urine output. Health teaching and health promotion. Clients should contact their healthcare provider immediately if experiencing unusual sweating, dizziness, heart palpitations, or chest pain. Now let's take a closer look at the medication grid on dopamine in Table 3.4.15b. Table 4.15 Billion's dopamine medication grid, 4.16 acetylcholinesterase inhibitors. Donepezil is an example of a cholinergic and acetylcholinesterase inhibitor. Acetylcholinesterase inhibitors are a class of medications that inhibit the activity of the enzyme acetylcholinesterase. This enzyme is responsible for breaking down the neurotransmitter acetylcholine. When acetylcholinesterase is inhibited, the concentration of acetylcholine at the synaptic cleft between nerve cells increases, improving nerve transmissions between cells. Mechanism of action: anticholinesterase breaks down the neurotransmitter acetylcholine. Acetylcholinesterase inhibitors block this action, decreasing the availability of acetylcholine. Indications: donepezil is an acetylcholinesterase inhibitor used for the treatment of cognitive symptoms associated with Alzheimer's disease. Nursing considerations when administering donepezil: nurses should be sure to administer with food in order to minimize GI upset. Donepezil should be taken once per day, typically in the morning, to reduce side effects related to sleep quality and nightmares. Donepezil may increase liver enzyme levels. Side effects: adverse effects. Common side effects of donepezil include GI upset, headaches, dizziness, insomnia, fatigue, muscle cramps, reduced quality of sleep, and nightmares. Health teaching and health promotion: depending on the severity of cognitive impairment, clients may require assistance to ensure the medication is taken each day. If clients miss a dose, the dose should be taken as soon as possible, unless it is close to the next dose time. If it is close to the next dose period, the individual should skip the additional dose. Clients should be instructed to take the medication with food to minimize GI upset. Now let's take a closer look at the medication grid on donepezil in Table 1.4.16. Table 4.16 donepezil grid, 4.17 Learning activities. Light bulb moment: test your knowledge and application. Practice applying your knowledge regarding ANS neuroreceptors to the following client scenarios where a nurse must use clinical judgment for a solution. 1. A client begins a nicotine patch in an attempt to stop smoking. The client reports feelings of nausea, weakness, and a rapid heartbeat. A. What is the likely cause of these symptoms? B. What is the nurse's best response? 2. A client with benign prostatic hyperplasia has a new order for tamsulosin. He asks, how will tamsulosin help me? I already take so many pills. A. What is the nurse's best response? B. What does the nurse plan to monitor carefully, especially after administering the first dose of tamsulosin? 3. A client with asthma is taking albuterol to help when she feels increased shortness of breath. How will albuterol assist in her breathing? The client states, after I take albuterol, it feels as if my heart is racing. B. What is the likely cause of this symptom? C. What is the nurse's best response to the client's concern? 4. A client with high blood pressure is prescribed propranolol. A. How will propranolol help to lower the blood pressure? B. What will the nurse assess before administering the propranolol? The nurse listens to the client's lungs a few hours after administering propranolol and notices new wheezing. C. What could be a potential cause of this new finding? D. What is the nurse's next best response? 5. A client is prescribed metoprolol to help control his atrial fibrillation, an irregular heart rhythm. What will the nurse assess before administering the metoprolol? B. What findings would cause the nurse to call the provider before administering the metoprolol? Upon reassessment the next day, the nurse notices a new finding of edema in the client's feet and lower legs. C. What could be a potential cause of this new finding? D. What is the nurse's next best response? 6. A client with an acute episode of heart failure is admitted and is prescribed dobutamine. How will dobutamine improve the client's condition? B. What will the nurse monitor carefully during administration? Note: answers to the light bulb moment can be found in the answer key section at the end of the book. Mr. Lau is a 42-year-old male who was referred to the outpatient clinic for treatment of hypertension and attention deficit hyperactivity disorder. He has a history of uncontrolled hypertension despite lifestyle modifications and multiple medication trials, and reports symptoms of inattention, impulsivity, and hyperactivity consistent with ADHD. Assessment: vital signs: blood pressure 150/100ths mmHg, heart rate 90 ppm, respiratory rate 20 breaths minute. Physical examination: well-nourished and well-developed male in no acute distress. Lung exam reveals clear breath sounds. Patient report: Mr. Lau reports difficulty with attention and organization and experiences high levels of stress and anxiety, particularly in high-pressure situations at work. Laboratory results: blood urea nitrogen 14 mg dl, creatinine 1.2 mg dl. 1. What medication would you expect to be prescribed to treat Mr. Lau's hypertension and ADHD? 2. Prior to administering this medication, what assessments should be performed? 3. It is early August and Mr. Lau wants to begin an exercise regimen that includes running outdoors. What health teaching should be provided to Mr. Lau? Note: answers to the case study can be found in the answer key section at the end of the book. Case Study 2. Mrs. Lenny Anton is a 57-year-old female who was referred to the outpatient clinic for treatment of essential tremor and hypertension. She has a history of uncontrolled hypertension and reports persistent tremors in her hands that interfere with her daily activities. Assessment: vital signs: blood pressure 145/90ths mmHg, heart rate 80% BM, respiratory rate 16 breaths minute. Physical examination: well-nourished and well-developed female in no acute distress. Lung exam reveals clear breath sounds. Patient report: Mrs. Anton reports difficulty with fine motor tasks due to her tremors and experiences high levels of stress and anxiety, particularly in social situations. Laboratory results: blood urea nitrogen 18 mg dl, creatinine 0.9 mg dl. 1. What medication do you expect to be prescribed to Mrs. Anton? 2. Mrs. Anton is prescribed an extended release form of the medication. What special instruction should be given related to this form of the medication? 3. Mrs. Anton monitors her blood pressure and heart rate at home, noting a gradual decline over the past 2 weeks. This morning she notes that her blood pressure is 89/99 and 56ths mmHg and her heart rate is 52% BPM. What action should Mrs. Anton take next? Note: answers to the case study can be found in the answer key section at the end of the book. Interactive activity. An interactive H5P element has been excluded from this version of the text. You can view it online here. PNS versus SNS quiz by E. Christman for OpenRN is licensed under CC by 4. Interactive activity. An interactive H5P element has been excluded from this version of the text. You can view it online here. Test your knowledge with this NCLEX Next Generation Style question, ANS receptors. Test your clinical judgment with this NCLEX Next Generation Style Bowtie question, beta-1 antagonist. Test your clinical judgment with this NCLEX Next Generation Style Bowtie question, alpha-1 antagonist. Fourth glossary. Acetylcholine binds to both nicotinic receptors and muscarinic receptors in the PNS. Adrenergic postganglionic neuron, where neurotransmitters norepinephrine and epinephrine are released. Includes alpha receptors and beta receptors. Adrenergic agonist mimics the effects of the body's natural SNS stimulation on alpha and beta receptors, also called sympathomimetics. Adrenergic antagonist blocks the effects of the SNS receptors. Anticholinergics inhibit acetylcholine, which allows the SNS to dominate. Also called parasympatholytics or muscarinic antagonists. Overall use is to relax smooth muscle. Autonomic nervous system controls cardiac and smooth muscle, as well as glandular tissue associated with involuntary responses. Catecholamines include norepinephrine, epinephrine, and dopamine, stimulate the adrenergic receptors. Central nervous system, anatomical division of the nervous system located within the cranial and vertebral cavities, namely the brain and spinal cord. Cholinergic, postganglionic neuron, where acetylcholine is released that stimulates nicotinic receptors and muscarinic receptors, also relating to drugs that inhibit, enhance, or mimic the action of ACH. Chronotropic, drugs may change the heart rate and rhythm by affecting the electrical conduction system of the heart and the nerves that influence it, such as by changing the rhythm produced by the sinoatrial node. Positive chronotropes increase heart rate, negative chronotropes decrease heart rate. Dromotropic, stimulation increases speed of conduction between SA and AV node. Fight or flight response, the response when the SNS is stimulated, causing. The main effects of increased heart rate, increased blood pressure, and bronchodilation. Glycogenolysis, the breakdown of glycogen into glucose, causing elevated blood glucose. Homeostasis, balance between the SNS and PNS. At each target organ, dual innervation determines activity. For example, SNS stimulation causes the heart rate to increase, whereas PNS stimulation causes the heart rate to decrease. Hyperglycemia, elevated blood glucose. Inotropic, stimulation causes increased force of contraction. Involuntary responses, responses that the brain controls without the need for conscious thought. Motor neurons consist of the somatic nervous system that stimulates voluntary movement of muscles and the autonomic. nervous system that controls involuntary responses. Muscarinic agonists, also called parasympathomimetics, primarily cause smooth muscle contraction, resulting in decreased HR, bronchoconstriction, increased gastrointestinal genitourinary tone, and pupil constriction. Neurons, cells that carry electrical impulses to the synapse of a target organ. Non-selective beta blockers, medications that block both beta-1 and beta-2 receptors, thus affecting both the heart and lungs. Parasympathetic nervous system includes nerves outside the brain and spinal cord, associated with the rest and digest response. Stimulation of PNS causes decreased heart rate, decreased blood pressure via vasodilation, bronchial constriction, and stimulates intestinal motility, salivation, and relaxation of the bladder. Parasympatholytics inhibit acetylcholine, which allows the SNS to dominate. Also called anticholinergics or muscarinic antagonists. Parasympathomimetics, also called muscarinic agonists, primarily cause smooth muscle contraction, resulting in decreased HR, bronchoconstriction, increased GI, GU tone, and pupil constriction. Peripheral nervous system, an anatomical division of the nervous system that is largely outside the cranial and vertebral cavities, namely all parts except the brain and spinal cord. Postganglionic neurons differ for the SNS and PNS branches. Postganglionic neurons of the autonomic system are classified as either cholinergic, meaning that acetylcholine is released, or adrenergic, meaning that norepinephrine is released. Preganglionic neurons release acetylcholine. Selective beta blocker, medications that mostly inhibit B1 receptors. Sensory neurons sense the environment and conduct signals to the brain that become a conscious perception of that stimulus. Sludge, mnemonic for the effects of anticholinergics, salivation decreased, lacrimation decreased, urinary retention, drowsiness, dizziness, GI upset, eyes. Somatic nervous system causes contraction of skeletal muscles associated with voluntary responses. Sympathetic nervous system associated with the fight or flight response. Stimulation causes the main effects of increased heart rate, increased blood pressure via the constriction of blood vessels and bronchodilation. Sympathomimetics mimic the effects of the body's natural SNS stimulation of adrenergic receptors, also called adrenergic agonists. 4. Chapter 4. Answer key to Chapter 4. Section 4.17 Lightbulb moment. 1. A potential side effect of nicotine is the activation of the sympathetic nervous system that causes an increased heart rate. Nausea and weakness are potential side effects that can indicate nicotine overdose. The nurse should provide health teaching to the client regarding the avoidance of additional nicotine when using the nicotine patch. It may also be helpful to remove the patch at bedtime and reapply a new patch in the morning. You can review additional information about nicotine administration in the nicotine receptor agonists section. 2a. The nurse should explain to the client that tamsulosin relaxes muscles in the bladder and prostate to improve urine flow. 2b. The nurse should monitor for hypotension and tachycardia, especially after administering the first dose of medication. The nurse should also advise the client to change positions slowly in order to prevent falls that can occur due to hypotension. You can review additional information about tamsulosin in the alpha-1 antagonists section. 3A. Albuterol stimulates beta-2 agonist receptors in the smooth muscle of bronchi and bronchioles to produce bronchodilation to ease the work of breathing. 3B. Beta-1 receptors can also be inadvertently stimulated by albuterol and cause the side effect of tachycardia. 3C. The nurse should educate the client to take the medication as prescribed and avoid caffeine or other stimulants that can cause tachycardia. 4A. Propranolol is a non-selective beta blocker and inhibits both beta-1 and beta-2 receptors. Inhibiting beta-1 receptors will decrease the heart rate and reduce the force of the heart's contraction, which will lower the client's blood pressure. 4B. Before administering propranolol, the nurse should always assess the client's blood pressure and apical pulse. If the systolic blood pressure is less than 100 mmHg, or the apical heart rate is less than 60 beats per minute, the medication should be withheld and the provider notified unless other parameters are provided in the order. 4C. Propranolol can inadvertently cause bronchoconstriction because it inhibits beta-2 receptors, in addition to beta-1 receptors. Bronchoconstriction causes wheezing. 4D. When a nurse notices new wheezing, a focused respiratory assessment should be performed, including assessing the client's airway, respiratory rate, and oxygenation status. Depending on the urgency of the assessment findings, the nurse should also check the client's medical record for a history of asthma or chronic obstructive pulmonary disease and immediately notify the provider. You can review additional information about propranolol in the beta-2 antagonist section. 5A. Before administering metoprolol, the nurse should always assess the client's blood pressure and pulse. 5B. If the systolic blood pressure is less than 100 mmHg, or the apical heart rate is less than 60 beats per minute, the medication should be withheld and the provider notified unless other parameters are provided in the order. 5C. A new finding of edema can indicate that the adverse effect of worsening heart failure is occurring. 5D. The nurse should assess the client for additional signs of worsening heart failure, such as fine crackles in the lungs and recent weight gain, and notify the provider regarding this change in client condition. You can review additional information about metoprolol in the beta-1 antagonist section. 6A. Dobutamine is a catecholamine, and it will increase heart rate, the force of heart contraction, and speed of conduction between the SA to AV nodes. These actions will help to improve cardiac output for a client experiencing an acute episode of heart failure. 6B. During administration of dobutamine, the nurse should continuously monitor the client's heart rate, blood pressure, ECG, cardiac output, and urine output. Increased urine output will demonstrate the effectiveness of the medication in perfusing the kidneys. You can review additional information about dobutamine in the alpha and beta receptor agonists section. 1. The preferred treatment for hypertension and ADHD is clonidine. 2. Prior to administering clonidine, the nurse should collect vital signs, including heart rate and blood pressure. It is also important to ensure that the client does not have any allergies to the medication. 3. Mr. Lau should be encouraged to begin an exercise regimen gradually. Individuals receiving clonidine are more susceptible to hypotension with exercise, especially in environments of extreme heat. Section 4.1, 7 Case Study 2. 1. Mrs. Anton would likely be prescribed propranolol. 2. For any ER medication, clients must be aware that the medication cannot be crushed. 3. Mrs. Anton should recheck her blood pressure and heart rate. Once she has confirmed the findings, she should phone her provider to report the findings. The medication dosage may require an adjustment.